So welcome back, everyone. So nice to see you all here. So before we get started, let's start with a prayer. Yo Vishwam Vidadhati Pati Satatam Samharayatyanjasa Srishtva Devya Mahasjadischa Vividhat Durikarotyamayan Viprano Jalana Chakasti Bhuvane Piyushapurnam Ghatam Tam Dhanvantari Rupameshamamalam Vandamahe Shreyase Vandamahe Shreyase Vandamahe Shreyase. Om Shanti Shanti Shanti. So nice to have you all here. So today's topic is actually a very important and relevant one. And you guys are lucky because I had not done this topic for the last class because we ran out of time. But I'm so glad that we got a chance to do it this time around because I realized how important this is and how common it is that you guys are going to be seeing people who have Lyme disease or Lyme-like symptoms, and the vast controversy that surrounds this condition and the treatment for it. Okay, so let me see here. This is always a little bit difficult to do because, okay, there we go. There we go. Let's put this back up here. Okay, so today's topic is Lyme disease, which is, as I was reading about it and I mentioned to you, there were so many times that I just broke out laughing because of the sheer confusion that surrounds this condition. And I can see why. It does make a lot of sense as to why this can be so confusing, why there are so many different opinions, and each person has their own logic as to the difficulty of understanding this condition. So first, I kind of want to go through what the disease is and why it's controversial and why there are so many questions surrounding it. And then as we go through it, of course, try to keep in mind, excuse me, try to keep in mind all the things that we've talked about over the weekend and what we've talked about previously. And, put on your Ayurvedic lens as well whenever you're listening about these conditions, because it always starts to bring out different ideas as you go through it. Okay. So Lyme disease is a condition that is brought on by the exposure of the Borrelia, I can never pronounce these things correctly, Burgdorferi bacteria. And so the reason why it has that particular name, the person who discovered that this is a different kind of condition, his name is Bergdorf. And so they named, or he was the one who found out and understood that this is the bacteria that's causing this disorder. And so they named the bacteria after him. Okay, but typically most people refer to it as the Borrelia bacteria, which is common for Lyme disease. Okay, so this disease was first discovered or understood as a different condition. Initially, when it started to present, people thought that it was childhood onset of arthritis, early onset arthritis, and so it didn't necessarily respond in the same way. And when they realized that there's other factors involved, that's how outbreak of disorder in Connecticut from Lyme. And it's one of the areas that has a massive occurrence and incidence of Lyme disease. From Canada here, but it's something from the Canada, like there's some information about But when I tried to look up, I still had max and sort of epidemiology stuff. Okay. Okay. So Lyme disease is rapidly increasing, as you can see from this nice little thing that I found, where it shows on the map the occurrence of Lyme that was found, say, in 1996. And as you can see, as it changes, the spread and the and the widespread occurrence of it with over the past 15 to almost 20 years now. Okay. So Lyme disease is rapidly increasing condition, not just in North America, but around the world. Lyme has been reported in over 80 countries around the world. And since 2012, the Center of Disease Control, or the CDC, has named Lyme disease as one of the top 10 disorders occurring in the US. There are over 329,000 new cases of Lyme each year. And when they mean by new cases, that means new cases that have been diagnosed apart from the people who had it last year and got diagnosed last year. Okay, so that is a very big number for it to be occurring every year. Okay, and probably even more so. So some believe that the incidence of Lyme has increased due to the awareness. So maybe prior to this, there probably were a lot of cases of Lyme, but people weren't as aware of it, and they weren't really, they weren't diagnosing as Lyme. So that's probably one of the reasons why we didn't find such high numbers for Lyme disease prior to this current period. So many more have Lyme than those reported. The statistics also indicate that that could be a possibility. So even greater than these numbers that they've put out by the CDC, we could probably have more people with Lyme. Okay. So Lyme it's also known as the great imitator, and the reason why is because the symptoms that you find with Lyme disease is so commonly found in many other conditions, that it's very hard to have a differential diagnosis between Lyme and, say, fibromyalgia or chronic fatigue. So some of the symptoms that a person who has Lyme may present with, and this is of course not being specific as to whether it's an acute or chronic, but in general, they tend to have widespread pain, flu-like symptoms, enlarged lymph nodes, insomnia, body shakes, numbness in the feet, pain in the tendons, immense fatigue, and brain fog. But then this is just a few of them. There are lots and lots of symptoms that can also be found and associated with Lyme. And the conditions that also have similar symptoms to this, or a few of these symptoms that you can find in these other conditions, are like chronic fatigue syndrome, fibromyalgia, multiple sclerosis, and certain psychiatric illnesses, including depression, may also present with somewhat similar symptoms as well. Okay. So for Lyme, what causes Lyme? And this again is looking at the accepted definition, or how someone is really termed as, do you really have Lyme disease or not? Okay, so what causes Lyme disease? In order to be diagnosed with Lyme disease, the patient must have been exposed to the Borrelia bacteria at any point in time. Okay. Typically, the Borrelia bacteria spreads through the deer nymph tick. So nymph is just indicating sort of the age of the tick. It's not a completely baby tick, but it's not an adult tick. It's sort of like an intermediate. You could say it's like a teenage tick in a way. It's an immature tick. And the Borrelia bacteria is supposed to be stored within their saliva, in their mouth, their antlers, where they actually bite through. So these ticks are typically found in the New England area and the upper Midwest states. And also it has been somewhat found in the West Coast of the United States, but it's not necessarily the case, because if we look at the incidence of the disease, it does not always correlate with the presence of the deer tick. That's why some researchers believe that it's not just the deer tick that can spread this particular bacteria, but it may also be spread through the white-legged mouse, which you see over here. Okay, so this is the white-legged mice, and these white-footed mice. Sorry. So on the west coast of the United States has a greater incidence of Lyme, and some research believe that it's also spread through the white-footed mice, which are more common in forest areas that have been recently excavated. So they say that one of the reasons could be why Lyme has spread so drastically in the past few decades, and why we're finding it more, is because they said that when you're cutting down particular forests or different types of natural areas, and as they're excavating this, it actually allows for the deer and the ticks that come along with them to actually spread to more rural and suburban areas. And not only through the ticks, and not only necessarily through the deer population, but what also comes along with the deer are these particular types of mice. So for instance, in places where we may not necessarily have a deer population, but there is this mice, you can probably find Lyme disease in those places as well. Because I also had this question, what about, say, in other countries that don't necessarily have a deer population? They don't have a wild spread of, deer migrating from one place to the next. Then what is the occurrence? Why is there an occurrence of Lyme disease there? Because there are many countries that may not necessarily have that kind of population. But these particular type of mice are fairly common in most areas where there is sedimentation, or there is any type of accumulation of garbage or any sort of unsanitary condition. These mice can be found there. Okay, so it's not necessarily that it has to be from a forested area. Okay, so this is one of the conditions. Just keep this in mind. So what happens if you get bitten by the tick? Okay, so if the deer tick, or even if the mice bite someone, it comes in contact with the skin, it may latch on and feed for several days. So the longer the contact of the tick on the person's skin, the greater the chance of getting the infection. And that's the reason they say that the tick actually needs to feed. It needs to feed on blood in order for it to mature from an immature tick or a nymph tick to an adult tick. So what happens is when it's consuming the blood, it actually becomes engorged. And so the more blood it consumes, the easier it is for it to then spit out this particular bacteria. And the reason it does that is when it attaches onto the skin, it releases certain amount of bacteria and one particular type of components in their saliva that actually can temporarily kind of numbs that area, so the person doesn't necessarily feel the bite, as well as it produces a sort of like a gum-like consistency, something that it also spits out, so that it helps it to attach to the skin. So for those of you who've ever had a tick bite, you know that trying to get the tick off the skin is really hard. It really is almost like it's glued onto the skin. Okay, so that's the mechanism of what the tick does in order for it to stay in place, so it can feed for a longer period of time. And when it gets engorged, it's more amount or more quantity of the substances that it produces through its saliva actually gets flushed back into the person. That's why the chance of getting the infection is greater as from when the tick is on the skin for a longer period of time. Okay, so typically the deer tick bite can produce a bullseye-like rash, and this is kind of what it looks like, where from the place where it attaches on, and then it produces this kind of spreading type of rash, which looks almost like a bullseye. And this is also one of the normal diagnostic criteria for determining if someone has Lyme disease. However, many patients with Lyme disease may or may not have been bitten by a tick and have not presented with the expected bullseye rash. So as I was I was reading, there is this instance where If someone was bitten by a tick, most likely they may not have even seen the rash, or they didn't know. That's why it can come up much later on. As well as there are people who have indicated that they were bitten by the tick. They found the tick, they took it off, but they did not ever develop the rash. And even though they didn't develop the rash, later on they still were diagnosed with Lyme. So the occurrence of the rash isn't necessarily a very good criteria to say that if you have the rash, you're definitely going to have Lyme disease, and if you don't have it. It's just one of those factors that help, but isn't very definitive to say yes or no for Lyme. Okay. So others suspect the majority of the Lyme population may have had the rash, but it's gone unnoticed. Okay. So that's one of the rationale for why that may happen. Okay. So what are the symptoms of Lyme disease? If someone has this condition, what they typically present with? And there are kind of two ways to look at how Lyme disease presents, because you can have the immediate reaction of just after, within a few days or a few weeks of having the tick bite, they can produce some particular type of symptoms. And then you can also have the delayed onset or a prolonged effect of Lyme disease as well. Okay, so the acute or immediate sort of symptoms that a person may have, and again, it's not necessarily the case. Some people have it, some people don't. They may have, again, that red expanding skin rash. They may also present with facial nerve weakness or Bell's palsy, flu-like symptoms such as fainting, shortness of breath, palpitations, which means they feel like their heart is beating, beating in their chest. They can actually feel the heart beating, and also chest pain. They may also present with severe headaches, neck stiffness, shooting pain that may interfere with their sleep, lightheadedness, and pain and swelling in the large joints. Okay. And there's some people who may have this. Typically after this they get treatment, or there may also be people who have had a tick bite, either know about it or do not know about it, and may not necessarily present with these symptoms, but start presenting symptoms long after they were exposed to the tick, or long after they were exposed to the bacteria. Okay. So the prolonged or delayed symptoms that may occur are things like fatigue, and the fatigue tends to be fairly, debilitating, which is one of the reasons why it looks so much like chronic fatigue and why it also looks so much like fibromyalgia. The person also complains of headaches, psychiatric disorders like depression and mood changes, and sort of that brain fog is also another very, very common symptom with Lyme disease. They may also present with, again, joint pain, muscle aches, twitching, memory loss, cognitive impairment, sleep impairment. One of the clients I had said that she can't remember things. Like, she will do something, and if you ask her about it, she'll say, "No, I don't ever. I don't think I did that." And then after a couple of days, then she'll think back and she'll remember, "Oh yes, I actually did do that. I now remember. I'm sorry, I told you no, but it was yes." So that kind of memory loss also was very common with one of my clients. I saw that. Sleep impairment, heart-related symptoms, and sometimes it can be presented as either a physical heart-related symptoms, or sometimes it gets presented as emotions. So even in the sense that they start having extreme grief or extreme despair, or extreme fear, which aren't necessarily things that they would have felt before. Digestive issues like IBS, and that's just one example of some of the digestive issues that they may have. Neuropathy, such as numbness or a hot and cold sensation, and tingling. Okay, and again, these are just some of them. The reason why Lyme is also somewhat difficult to understand is because apart from just these symptoms, there could be many other symptoms that is added on to this list apart from just this, right? I know someone's Lyme that presented like schizophrenia. Yep. And it can get pretty bad. And that's what I realized as I was reading up on these cases and the whole issue of Lyme is that it's a pretty difficult disorder, and it can have some very severe consequences. And unfortunately, the treatment options that are out there are not very effective. So you're left with a lot of people who have this condition, who have no access or no kind of treatment that is available, or that is at least accepted or available from their doctors. And if they're not aware, or if they don't have access to other types of therapies, then that's what they know, and that's kind of what they're left with. And it's very, very unfortunate. Yeah. Okay. So these, just keep in mind some of these symptoms. So this is how Lyme is typically diagnosed. And the reason why they do this is basically what they're looking for in the lab test is to identify the antibodies to the bacteria, and that can help to confirm the diagnosis. They say typically it's best within a few weeks after the infection. And so there are two types of assays that they will do, either the enzyme immune assay or the immunofluorescence assay. And in that, again, whether it's positive or negative, they'll look for these particular results, and also look to see if there are associated signs and symptoms that are presenting, if this has happened within less than 30 days, or if the signs and symptoms are occurring greater than 30 days, then they also will do a further test to check the immunoglobulins. Now, the issue with this is that this also is somewhat controversial, is because the tests don't always indicate whether somebody has Lyme disease or not. Because sometimes another group of researchers have said that in many cases, even if a person say they were exposed to the tick and they got bitten, and it may take a really long time for their body to produce the antibodies, and that may also happen without it producing any kind of symptoms. Now, if the body is producing these antibodies or not producing the antibodies, if there isn't a significant amount, it still cannot be detected by the test. So the test itself is really not the best way for them to detect this. The problem is if a person having Lyme, like I mentioned earlier, one of the ways to look at and to see if somebody has Lyme is that they should have the antibodies, or they should have this bacteria in their system, right? So if they have the Borrelia bacteria, or they have the antibodies for it in their system, that is what the main criteria is for a person having Lyme, right? If they don't have that, then they don't have Lyme. They may have something else, but they don't have Lyme. However, there's also this problem that many people, and it's not just a small group, it's probably around 40 to 50% of the patients who have Lyme disease, or who are in the chronic stage of Lyme disease, they may not have, there's no sign and no indication that they have the bacteria in their system, or they have the antibodies to their system, and they are still presenting with all the signs and symptoms of Lyme. Okay, and so that becomes difficult, is that whether do they really have Lyme or do they not have Lyme. There are other people who have been treated for Lyme disease in the earlier stages and were perfectly fine, and then after they start to develop the symptoms of delayed Lyme again. And then after that, even again, if you do the test, the test doesn't necessarily indicate that they have the antibodies or they have the bacteria still present in their system, but they're still presenting with Lyme. So the test doesn't really indicate if the bacteria is completely gone or if it's still there latent. It doesn't indicate that. So that's the reason why this is, again, another really tricky method of how do we figure this out. Okay. So the challenges with the diagnosis. So this is, again, just a summary in a way. So the bullseye skin lesion doesn't occur in everyone bitten by the tick. The antibodies for the Borrelia bacteria are not always produced immediately after contact, and it may take days or even weeks for the body to produce the antibodies, which can then be detected by testing. Some researchers believe that the condition of Lyme disease can occur with exposure of babesiosis, which is another type of bacteria, and that also produces a lot of the similar symptoms to that of the Borrelia bacteria. So there are some researchers that believe that it's not just the Borrelia bacteria alone that is producing Lyme disease, but it's also this particular malaria-like bacteria that can also produce symptoms or can produce this condition of Lyme disease. Whereas others indicate or attribute the disease to a combination of bacteria, viral, and parasites, which can all come from the deer tick or from the white-footed mouse. So it's not just this one bacteria that is being secreted into your bloodstream when the tick bites you. It's a few things. So they think that that's one of the reasons why it becomes so complex, why the condition continues to exist even after the person has had treatment, or maybe one of the reasons why it's so difficult to treat it in the first place. Okay. Many people who have chronic Lyme do not have the infection. And also the problem is you cannot have Lyme without the Borrelia infection. So what do you do with all these people who do not have the infection but have chronic Lyme disease? Okay. So it's basically like telling them, well, you don't really have Lyme disease, but we don't really know what you have. But they're presenting with all the symptoms of Lyme disease. Current tests make it impossible to know if the infection is cured. Okay, so that's also one of the controversies that surrounds this condition. So the treatment that is typically done for Lyme disease. So if, for instance, if you find out that you were bitten by a tick or you present with the bullseye rash, what the doctors would usually do is put you on a course of antibiotics, and it typically tends to be around 3 weeks. Sometimes it can be up to 30 days or 4 weeks, but ideally it's minimum of a 3-week course. And so in some of the antibiotics that they may use is doxycycline and so on and so forth. I'm very bad at pronouncing these names. They may also prescribe different type of NSAIDs, which is the non-steroidal anti-inflammatory drugs that helps to relieve pain, inflammation, and fever. And if the condition continues to persist and if the person is presenting with neurological symptoms, then they may also opt to then again put the person through another course of antibiotics, which can be penicillin antibiotics, typically like amoxicillin, which again would be another 3 weeks. So this is the typical management. They say that if antibiotics is given to the person when there is the initial exposure or the initial infection, they are more likely to be have a very good response to the antibiotics, and they're more likely to be fairly cured from the condition. Now, there's this other set of group of people who may have initially responded to the antibiotics or may have not responded to the antibiotics, but sometimes they end up with this long-term presentation of Lyme disease. And in that, it's again, either it's a delayed effect, it didn't show up initially when they got bitten, or when they got exposure to the bacteria, but it takes a while and later it shows up in their system. And when it shows up in their system, again, sometimes the antibiotics are given that actually help to suppress some of the symptoms, but then after a while, it may not necessarily produce very significant effects. So again here, or oral antibiotics is prescribed for an extended period. Sometimes it can be up to 8 months to 1 year of a person taking antibiotics, and tends to be very strong antibiotics. If they do not respond to that, then they upgrade them to IV antibiotics. And those are with really high doses. That is a very high grade antibiotic aimed at getting rid of the bacteria and to reduce inflammation. Okay, so the use of antibiotics past the period of 3 weeks course may not yield significant effects. It may enhance the symptoms and hazardous outcomes, including a rare consequence of death. So I even found a few cases of people who were on the IV antibiotics that were so extreme that it basically destroys all the other kinds of bacteria in the body as well. that the person actually did not then have the components necessary to fight off other infections, which seems kind of counterproductive, that you would take antibiotics to prevent or to get rid of an infection, but then it gets rid of all of the other components to fight infections. So then it actually breaks you down so that you're more susceptible to an infection. Okay. And that's kind of what happened with those rare cases of people who died from taking the IV antibiotics. It wasn't the antibiotics that necessarily caused the death in a way. It did, but it caused it indirectly because it broke down the system that then made it susceptible to be reactive for simple bacteria. Okay. So many patients of Lyme disease may have reoccurring symptoms of Lyme even after having taken antibiotics treatment. And this is around 20% of patients. And I think it's probably even more than that, but that's at least the number that they have reported, that 20% of people who take this treatment are most likely going to have reoccurring symptoms even afterwards. Okay, so there isn't really much of a guarantee with this method of management that they're going to be cured or they're going to really be effectively managed with this condition. So the dilemma of the post-treatment Lyme disease syndrome, that's what it's called. So which means if you've taken antibiotics and for a while you were fine, and then after the Lyme comes back again, then it is termed as post-treatment Lyme disease syndrome. Okay, so in that, the issue with this is, again, short-term antibiotic therapy may suppress the symptoms of Lyme disease for a while, but rarely actually cure the disease. So chronic Lyme disease, and so this post-treatment is also termed as chronic Lyme, but most doctors don't like the term chronic Lyme, or that's what I read anyway. They don't like the term chronic Lyme disease. Because a complex condition affecting multiple symptoms such as neurological, musculoskeletal, gastrointestinal, and cardiovascular systems in the body. See, one of the issue is that I read in the process of doing some research of this is that there's this concept that in order for a disease to occur, it has to have one source. So always there is one cause for one disease. There cannot be multiple causes for one disease, which I believe they called it as the Pasteur's postulate. So there's one cause for one illness, and there isn't necessarily a multidimensional causation for disease. Okay, so which means if somebody has Lyme disease, they have to have this bacteria present or have had to have this bacteria affect their system, then and then only they have Lyme disease. And like I said, one of the other doctors quoted that if you do not have this bacterial infection, then you don't have Lyme disease. Okay, so that's where a big part of the question mark comes in. Evidence indicates that something more complex is occurring in these patients, and that quote also comes from a doctor who commonly deals with Lyme disease patients. Many may not have the antibodies of the Borrelia bacteria, but still present with chronic symptoms of Lyme disease. So some experts believe that the lingering symptoms might be due to an autoimmune disorder, or others say that the Borrelia bacteria produces long-term effects and is never completely gone. And while others also claim that it may be another disease and not necessarily Lyme, or it may also be the person just making up their symptoms. Because if you look at a person who has Lyme disease, externally they actually look very healthy, or they look fine. You cannot tell what they're feeling or what is actually occurring on the inside because it doesn't present physically to the outside world. So even that also was stated by a doctor, by the way, that sometimes it could either be a whole other disease that looks like Lyme, or it could just be them making up their own symptoms. So there are fake symptoms too. Okay. Like a lot of mental issues. Yes, you can't see it, and you look at someone. Yeah, absolutely. And that's the same thing what happens with Lyme disease as well. So again, the standard treatment for chronic Lyme disease is antibiotic treatment, and it's supposed to be continued till the patient gets better. So which means if the person takes 8 months of antibiotics and they're still not getting better, they're going to keep giving you the antibiotics until you get better. Now, the issue with it is that insurance companies have decided that once you get past a certain level or a certain number of courses of antibiotics, then they realize that the antibiotics isn't necessarily going to do anything after that. So then they stop covering or they stop reimbursing for those courses of antibiotics. So even that becomes a problem as well. So that even if you have, the doctors are considering to continue the antibiotics till the person gets better, and then the insurance companies don't necessarily want to cover it because they think that it's not really going to do anything anyway. So again, the patients are stuck. That's another good question. Are antibiotics effective after many courses? And that's actually one of the things that they did mention, is the fact that it, like it says right here, in short-term therapy may suppress the symptoms, and that too temporarily, but rarely does it actually ever cure the disease. And actually, after continuous exposure or consumption of the antibiotics, in many cases, it actually makes the symptoms worse instead of better. Okay, so just keep that in mind too, that the measure that is used for curative or for management actually becomes part of the problem and makes the symptoms worse. So standard treatment for chronic Lyme is antibiotics, continue till the patient gets better, or determined if another disease is due to lack of responsive treatment. So they say if the person isn't responding to antibiotics, we'll keep giving it till they respond. Or the other option is, if they're not responding to the antibiotics, then it's probably not Lyme, it's probably another disease. And so therefore we need to figure out what the other disease is. And the main issue is, again, it kind of really boils down to this identification of whether the bacteria is there causing the disease or whether the bacteria is not there, even though the disease is still present. So everything is surrounded behind this bacteria, and all treatment is aimed at the bacteria, right? But the whole question becomes then, is it really just this bacteria, or what exactly is the problem? Because just as the other person said, is that there's definitely a multidimensional complex condition that is occurring, which can't necessarily be, again, this is my opinion or my take on it, is that it can't necessarily only be due to this one bacteria. Because if it was this bacteria, then why are there so many cases of people who have Lyme disease who don't have the bacteria? Okay? So, in saying that, there were so many things that came across while I was doing this, and I'm going to quickly just go back to here, and I'd like to discuss with you guys if you have, what are the questions you may have regarding Lyme disease? Does anyone have any questions or controversies regarding Lyme disease? You can speak up if you like.
Hi. So I do have, can you hear me? Okay, because now I can't hear you. Oh, well, anyhow, so I do have a question. I know a couple people who have had Lyme disease diagnoses. All of their symptoms, like you said, are completely different. It's like they're all doing different things, having different diseases. And in one case, it's somebody who has 3 different bacterias. And so it's almost like when she gets a handle on one thing, then something else goes sideways anyways, even though they're all bacterias. And so by that logic, you would think that she would take a couple courses of antibiotics and it would just sort of clear up the gong show. But the last time she was on antibiotics, she said it made it even worse. So it's like all 3 sets of diseases got worse being on the antibiotics. So I feel like it's a bit of a curious conundrum disease. And I look really forward to the Ayurvedic perspective, because I feel like a lot of people are struggling in the current system to find some form of remedy, some way of reducing their suffering. And it's almost like everything they try just makes it worse. And then they end up with all these autoimmune inflammatory conditions, and that's just a gong show. So I'm really glad we're covering this. I don't know if there's a question in there, but that's what I have.
No, absolutely. And probably even Bharti can explain to us even better how the concept of the antibiotics are really what it's supposed to do, how it works, because apparently all antibiotics don't work. They don't necessarily, or from my limited understanding anyway, they don't work on all bacteria. So you can't just give like one antibiotic and expect it to work on all bacteria. There are specific types of antibiotics that work on specific grades or specific types of bacteria or viruses or fungi. And so this also becomes part of the issue. That's why they have different types. And this is kind of, even there's a list of antibiotics that are not indicated, that are contraindicated for Lyme disease. But the whole issue is kind of looking at it and breaking it down to these particular types of bacteria. So Bharti, would you like to chime in on this?
So one of the things that I was thinking of was that, you know, how when you use a lot of antibiotics, different kinds, you're right in that one will not necessarily treat all 3 or 4, that they become resistant depending on the quantity of the bacteria, you know, and if the antibiotic is not in a strong enough strength that's given, then these bacteria have time to become resistant. So there's that multi-resistant flora as well. And so I'm just wondering, is this what happens, what Mona is talking about?
Yeah, I think that's exactly what happens. And the whole issue is that you have people who are taking the antibiotics now while they've been diagnosed with Lyme. But also, when you talk about the flora, and your body actually naturally has these same components.
Yes.
Right?
Yes.
Ideally, in the ideal world, our body is supposed to have all of these components.
Yes.
That actually can do the job of what the antibiotics is doing.
Yes, under normal circumstances.
Exactly. And if our body is not producing it, then we put in this, from an external source, these other types of aspects that was going to help to counteract the bacteria. Right? Now, if a person, and if we're looking at antibiotics in a whole scale, and from the onset or from the starting of a person's life till they have Lyme disease or till they start taking this antibiotics, how many antibiotics have they taken within that time period? Right. That also is going to affect the effectiveness of the antibacteria of the antibiotics, as you said, because it's also sort of setting up the person's own flora for this situation where it's a no-win situation.
Yes.
They're not having their own flora, their own components. They're basically their own immunity to counteract these components, which is what also these thoughts that came to my head is, I'm sure. Now, we're saying that it's due to an issue of the ticks and the bacteria and the deforestation that is causing the spread of these deer ticks, and then their population is coming down into the suburban areas, and therefore that's one of the reasons for the spread, the widespread, and the increase in the incidence, right? But think about it. Back in the day, there was more forest areas. People were living in the forest areas.
Yep.
They had more exposure and less preventative measures than we do now to basically protect themselves from these different kinds of ticks and so on and so forth. Mm-hmm. However, what I find curious is the fact that they knew very well about other conditions that were things that we could not necessarily control, and they, like for instance arthritis or all of these other conditions, were explained long before, and we knew all about these diseases and they were very well defined. But
Yes.
why was this not defined? And I understand that it seems like, again, the great imitator, it's very common, it's easy to mistake. But if you look at all of the diseases that it is being mistaken from, are also diseases that are occurring more in the past century or so.
Yes.
It isn't things that were ever described in the earlier days. So from a modern perspective, they may defend that, oh, well, there wasn't that much of diagnostic criteria in order for us to identify it. But the symptoms, if a person has a disease, the symptoms will be there, right? Whether you have diagnostic criteria or not, if a person is sick, they're sick. And if you're gonna have an occurrence of this disease, it's going to happen regardless of if you have the equipment for it or not. So people who had less protective measures were more widely exposed to this particular type were more exposed to this particular type of issue or contact with the bacteria, had not as much or not a wide explosion of this disease as it does now. And you, again, think about it. Why would it be occurring now and it didn't occur as much then? So that also becomes the question. If we're thinking only in the perspective of North America, that becomes one argument. What about other countries?
Yes.
So the same thing is, not every country is going to have a massive deer population. There are many countries that don't have a deer population, but they're still diagnosing people with Lyme disease. And this again becomes the issue, is that Lyme, because of the great imitator kind of concept, is easy now for people to be diagnosed with Lyme disease, even if they don't have the antibodies. Even if the test comes back negative, they are still being diagnosed as Lyme disease because of the symptoms. Now, even in this process, one of the doctors or one of the researchers made a statement saying that you cannot diagnose a disease purely on the symptoms. That is a very dangerous method of diagnosing.
Yeah.
However, if you're looking at the symptoms, and if people are being diagnosed with Lyme disease who don't have the one criteria that you'd have defined as this equals Lyme disease, which means having the bacteria equals Lyme disease. So what happens to that massive group of people who have Lyme disease who don't have the bacteria or don't have the antibodies for it?
So I don't know the answer to what you're saying, but there's this other aspect that I was thinking too, was that when a body is subjected to a bacterial infection or an entry of bacteria, it goes through these primary and secondary ways of fighting the infection, right? White cells kind of rush to the area and all that. And then eventually the antibodies start building. So the IgA, IgE are not the final permanent antibodies, but when it forms the IgG, you kind of feel that this is going to be your protection to the bacteria that specifically causes Lyme. Which isn't obviously is not happening, right? Because then if you're not curing it, then
exactly.
Exactly.
And the whole issue is, like, for instance, that's a good question, is that Mona just put up a question that the concept or the theory is the Pasteur's postulate, where that each disease has only one cause. Now, that is something that has been defined and is followed by evidence-based medicine. However, from an Ayurvedic perspective, that's not what we look at. And what we commonly find is that most other systems of medicine are also have the similar approach of looking at it as a multidimensional aspect. That's why there's this whole group and movement now of people who live with Lyme, there are different sort of activist groups of people who are suffering with Lyme, people who have Lyme, how to live with Lyme. and they are seeking other options to treat themselves because they know that the treatment that they have available to them is not working.
Yes.
So there's this really great article, which I got a lot of the information. I was reading a lot of tidbits here and there, but I read this article called The Lyme War in the New Yorker. And it kind of put it all together. And it was a really good description of all of the different opinions and the concepts that is that kind of lies around this disease. And in the first part of it, it's basically a case presentation of this young woman who got exposed to, again, Lyme. She had the tick. She found the tick on her shoulder, and she took off the tick, and so her mother took the tick and her to the doctor. But this was back in the day when the doctor wasn't as aware of Lyme disease. So even though she got bit by the tick, he said, oh, well, there's no rash or anything, so just go home. And she didn't get treated for it. And she was fine. So she never developed the rash. And also she never developed any of the initial symptoms. And that's what's curious. So she never developed any of the symptoms. She was perfectly fine. But after a couple of years, then she started to present with the symptoms of Lyme. And then it started to come on full force, right? And so then her Lyme disease started to get really bad. She was put on all of these different courses of antibiotics. She took the antibiotics. She ended up taking it for almost about a year. After a year, the insurance company decided that we're not going to pay for this anymore. So then her parents had to pay out of pocket for her to get antibiotics. They had put her on the IV antibiotics. It was so bad. She said after taking the antibiotics, it got worse, not better. And she would be lying on the floor, kind of just shivering and sort of just cringing into a ball, was completely non-functional. And her parents didn't know what to do. There was nothing they could do. They were just standing there and staring at her because they had no idea what to do. And finally, they sought after so many doctors and they went to so many specialists, and it was the same thing. So finally, she sought other help. She said, you know what, that's it. I'm not doing this anymore. So they were going to put her on another course of antibiotics, and she said, no, I'm done. And so she looked for alternative therapies, and someone told her to take ginger and turmeric. And apart from that, she did with the diet, where she went gluten-free. She cut out the processed food, no sugars. And then she said after doing that, she started to feel better. So, and you notice this, a lot of people who have Lyme disease do opt for these options. They tend to decide to go gluten-free as well, because they find that helps it to make them feel a little better. They are the ones also who have understood, not because of a doctor's recommendation, but because of how they feel and how other people who have the disease, who have done these measures, how they feel. And so because of their recommendations of the people who are actually suffering with it, because of their recommendations, these people are also joining in and trying that, because what is available isn't working. So keep that in mind too, because I think you should be starting to get somewhat of a clearer picture from what we've talked about as to if somebody goes gluten-free, why would that make them feel better? If somebody goes sugar-free, why would that make them feel better? If somebody takes ginger and turmeric, why would that make them feel better? Okay.
It's also interesting, like you say, so the chronic fatigue syndrome, IBS, and arthritis, they're all separate things. And then somehow we're lumping all of them together and saying, this is like, I don't know, this is.
It is very much like that. And I know if we look at it from our perspective, it seems, again, very simplistic. But with the simplicity of it, you can actually understand what is happening. Yeah. There is a very clear, logical description as to why this is occurring in each person. And as you figure this sort of equation out from an Ayurvedic perspective, you can very clearly predict why these things are occurring in these people, why they you can say it's like an upashaya, anupashaya. The upashaya where you add something in and where it makes them feel better, or where you expose them to something and it makes them feel worse, right?
Yep.
So even with that trial and error, that in itself indicates what that problem is. And if that figures out, that sort of solidifies your idea as to what the cause is and what the problem is, then the solution really isn't that hard. The thing about it is, if a person who has been taking antibiotics for up to a year, was rolling on the floor, incapable of doing anything, takes ginger and turmeric and changes her diet and starts to feel better, how does that make sense as opposed to the high-grade antibiotics?
Absolutely, yes.
So there is a logic. And I know it seems like we're making it very simple and just grouping things together, but that's because we're looking at it in that multidimensional concept. We're not looking at it as a reductionist method of this bacteria equals this disease. Because from this controversy itself, the doctors themselves are saying that the bacteria does not indicate the disease.
Wow, yes.
So it's not my opinion that I'm adding in there. It's what they're saying, which is one of the reasons why they find it so difficult to understand what to do with this. And even there are other doctors, there are a few of them out there who are MDs, but are practicing in a complementary method. And those who practice regular medicine with other sort of complementary or integrative medicine, they're the ones who are getting positive results. And so now they are being considered the Lyme specialists because they're regular MDs, but they have an integrative medicine approach.
Interesting.
So in looking at that, it really isn't very difficult to understand. So I'm going to show you that in a second, okay? So yes, and Mona says, if they're removing all the hard to digest food, is it then an Agni issue, indigestion from too much antibiotics? Yes, that is also one part of it. Part of the issue is the more chronic it becomes, the treatment that they're exposed to becomes part of the problem. So even just like they're saying that they took it initially and it made them feel a little bit better, but then afterwards they continue taking it and it makes them feel worse. And just like you're saying, whether it's the bacteria that is multiplying and becoming stronger and resistant to the antibiotics, or whether it's other components or other bacteria that are there, ideally, again, where is the body's own component in there? In that whole equation, what is happening to the body? Because we're looking at it from the perspective of it being these other external factors, and one is an external factor, then we're adding in another external factor, and it's creating this sort of collage and mess within a person's body. But what about the body's own ability? Where is it in that equation? Because we're kind of forgetting that that is a component that is responsible for how a person reacts. That's why, again, it differs from person to person, right? So just keep that in mind, and we'll explore a little more. Oh, wait, this one. There we go. Okay. So this is just about the confusion of what it is, okay? So this is kind of what I wanted to put together, something to kind of put the confusion all in one place, so it'd be easier to understand all of the confusion, okay? So you have a Lyme disease patient. Some of them, you have the bullseye rash or you don't have the bullseye rash. Then also it presents with symptoms. Sometimes they have symptoms after the acute exposure, or acute symptoms after exposure, or sometimes they have no symptoms or delayed symptoms. Then you have this investigation where even in that also, sometimes the person has the antibodies, sometimes they don't have the antibodies. Then you have this other concept or this other aspect of the antibiotics. You're taking treatment for it. Sometimes you have a positive response to the antibiotic, sometimes you have no response to the antibiotic. Then you have this other issue of, if you're taking prolonged antibiotics, even that can it can cause no change after a while, or it can make the symptoms to get worse. Then apart from that, if the person is not taking antibiotics, even that can also produce a positive response of them just feeling better and it taking care of itself, or it can reduce or cause the onset of symptoms, delayed symptoms. And all of this is kind of where you end up with this chronic Lyme disease. So it's almost like, I think for the most part, almost everyone who ends up with some exposure to Lyme disease at some point or another have a greater chance of developing chronic Lyme disease. And that, again, it depends. So keeping all of this confusion in mind, we're going to look at it from our perspective. So when we look at any disease, what are our criteria, right? We have our Ashtavida Pariksha, Dashavida Pariksha, and Dashavida Pariksha makes a very, very important component because it's basically assessing the playing field, right? It's your body is the playing field of where these diseases either occur or don't occur. And all of the components of what is happening within this playing field is what makes or what creates these changes within even one disease or within whatever is manifesting or sort of being grown or nurtured from within this field, right? So in that, one of the aspects that we look at and that we know is very important is the prakriti of the person. So in looking at whether it's Vata Pitta Prakriti or any one of the other 2 dosha Prakritis or 3 dosha Prakriti. Also, one thing to keep in mind is the Manasa Prakriti, or the state of mind of the person, whether the person is a Guru Rogi or a weak-minded person, or a Laghu Rogi or a strong-minded person. Because even in that, you will find a difference as to how the person responds. So a Guru Rogi or a weak-minded person may be someone who is somewhat either of a hypochondriac, or even if someone who has been through some sort of difficult situation and they are not at their best. So it makes them susceptible to be reactive to these different kinds of disorders and how their perception is. So like, it's a good thing that you mentioned this, that just like other psychological disorders, Lyme disease is another thing that you can't see. It doesn't necessarily present symptoms like that, but it is more subjective. There are a lot of things that occurs in Lyme disease, and the severity or lack thereof is actually subjective according to the person. So that's why I say that according to what the playing field is, will determine what the signs and symptoms or the intensity of that it produces. So here again, we're looking at it in a multidimensional aspect. We're not being reductionist that it's only the bacteria that's causing this problem. And remember, that's always the case. In any condition in Ayurveda, we're not looking at it as an external factor. We're looking at the fact that it is something, even if there is an external cause, you have an Agantuja disease. Even if there is an external cause, it still will produce different types of outcomes depending on the person that it is being exposed to or that it's doing its work on. So for instance, different types of bacteria or viruses or fevers, right? If a person has a very good immunity, is very strong, and they have a strong prakriti, or their doshas are balanced, then even though they have exposure to a particular virus, the virus isn't strong enough. The roga bala isn't strong enough to combat the rogi bala. The rogi bala itself is so much stronger that it cannot present the disease. Okay? So it doesn't necessarily mean that bacteria or the causative factor for that won't necessarily be there. I think the fact that even if it is this bacteria, it has the ability to stay latent. But then again, this is not the only bacteria. The one thing that is still a big mystery is the fact that there are thousands and thousands of different types of bacteria and viruses and other components that naturally live within our flora. They're still trying to figure out how much is actually there. So, which means that there are many different kinds of things that we already have exposure to. Our bodies have already figured out how to create a balance with the exposure of these components that does not produce a disease. However, whenever our systems tend to go weak, whenever our bala starts to reduce, whenever these components are not working well, that's when the roga bala gets a chance. So just like we look at whether it is dosha, chaya, prakopa, prasara, where we look at how it's increasing, there are multiple factors into how that may happen. And the way and the situation of what your body is in at that moment is what differs as to whether the symptom becomes a mild symptom or whether it becomes a very severe symptom, right? So just like we're looking at arthritis or we're looking at other conditions that aren't necessarily exogenous in nature, it's not due to an external causative factor, but it's due to different changes or issues from the inside, right? So even in those conditions, also, why does it differ from person to person? It's because of the sort of prerequisite factors that is there in that person. And what are your prerequisite factors? Your prakriti. So what is it? Dashavida prakriti, Dashavida pariksha. Dushya, desha, bala, kala, anala, prakriti, vaya, sattva, satmya, ahara, and avastha. Okay, so these are the things that determine where your baseline is, where you're starting off from. And depending on how that, now remember that is also something that's constantly changing. And that one is also something that has the ability to either stay stable or has the ability to become aggravated on its own or has the ability to become depleted, depending on what you're putting in every day, right? So whatever that baseline factor is then what determines how your body responds to or does not respond to when it is exposed to these particular types of bacteria. So that's why, even in the example of the girl who got the tick bite and her mom took her into the doctor and he didn't treat her and she was fine, is the example that she was exposed to the bacteria. But remember, when she originally got exposed, she was at a much younger age, where naturally your bala tends to be more. So even though you are exposed to the bacteria, if the bacteria is the cause for the disease, then regardless of who it is, it should produce the disease. However, in many cases, you're finding that even though the person has the tick bite and they are exposed to the disease, they're still not producing with the symptoms. And the reason why is if their bala is strong, it has the ability to combat or counteract the exposure to that bacteria, therefore not producing symptoms. However, one thing that they did find, and this question is also there, is that this bacteria, once it enters your system, doesn't necessarily go away. And even though you're continuously taking antibiotics, it's a very resilient bacteria. Whether it shows up on the test or it does not show up on the test, it doesn't necessarily go away, which is one of the reasons why you can very easily end up with the delayed onset of the Lyme disease, or you can have the chronic symptoms of Lyme disease. So in that situation, even in that, ask the question, when does it start to develop? If a person has the bacteria and the bacteria is supposed to produce the disease, then what makes it different? What is the determining factor that allows it to manifest at one particular time and does not allow it to manifest at a different particular time within the same person? So in that, again, it is determined by the field or the baseline or the place where it is growing, which is the person's body, right? So that's why if you are at a good, healthy state, you can be exposed and not produce any symptoms. But the minute other factors or other changes in your health or in your swastha or in your bala start to change, it then makes it very easy for these symptoms to come on. So just like we know, just like you were saying, in our flora, there is bacteria, there is natural occurrence and the natural production of these antibodies that we are able to fight off bacteria. Yes, there are. But is our body still strong enough to resist that onset, or is it not strong enough? Now, this is again comes back to the same sort of question. I was always wondering that I grew up here, right? There were lots of kids in school that used to get strep throat. And the occurrence of strep throat back then also was much less than it is now. But there were kids who would get strep throat, or they would have mono or something like that. And I would never get it. And I always wanted to know, like sometimes, you know, when you want to skip school or you want to get out of school, you'll go and sit next to the person who's really sick and ask them to cough on you, hoping that you'll get sick. But then why is it sometimes you just don't get sick? No matter how much they cough on you, no matter how much you try to exchange fluids so that you will get sick, like drink their soda or something like that, or, you know, whatever, so that you can get sick, and it doesn't happen. It's because your body is stronger enough that it doesn't allow it to come on. It doesn't allow it to have that onset. So that's why at that time I never got strep throat. But much later, as an adult, after having a child, then my immunity naturally is much lower. It's a little bit more depleted than it was before. So now at this time, it's easier for my body to react to those particular types of bacteria and those different stimulus, because I'm not at my level best. So my body can't resist those particular types of exposures. So after all these years, at the age of 35, was the first time ever I got strep throat. So it's interesting because the same person, same sort of bacterias and same exposure, but it didn't produce until much later. And what was the change between those times wasn't the change in the bacteria, and it wasn't change in anything else, but it was the change in me, that my immunity and my strength was lower. So it was very easy for those things to have an impact. The Rogi Bala was less than the Roga Bala. And the Roga Bala, when it's more, can very easily then work and start to enhance itself. Going straight back to that same schematic that we always look at. Okay? So just think of that. And what I have found is that people who have either any issue, anything that is reducing their own bala, the Rogi Bala, that makes the symptoms of the Lyme much more enhanced or much worse. So you almost always find that people who have Lyme, or who the symptoms when they start to get really worse are when they're under some kind of stress. So for instance, the person is like, for instance, the girl, she was a student in college, so she was under a lot of stress and not very good diet or lifestyle or anything like that. So there was another example of somebody who worked on Wall Street, and he was a big executive, and he got Lyme, and that sort of put things into perspective for him. But then look at the lifestyle, and that kind of sets the person up to have a much more enhanced reaction of this particular types of disease. Okay, so this is how we would look at it. The symptoms itself and how the body is reacting to a particular condition basically tells you, it always tells you, there are certain factors that we know how the body works, right? And we know that when it starts to deviate from its normal healthy function, what are the factors that can cause it to deviate in that manner? Those patterns we also know. So look for that, because if we were to try to spell out every possibility that there is in Lyme disease, it's going to take a very long time, and it'll be very hard, because we can't anticipate how many different presentations of Lyme that there actually is. But look at the common factors. And what you can see is you're still going to look at the same doshas and the same factors, the same Agni and the same malas, because all of those things are still occurring and they're constants in that equation, in that person. And when we start to see a deviation or a change in that, that's kind of what we're looking for. Okay? So keep that in mind, because that makes it, again, a lot easier to understand. Again, look at the diet of the person, look at the lifestyle of the person, and assess the presentation and understand the vikriti like any other vyadhi. Just like any other disease, whether we have a name for it in Ayurveda or we don't. Remember, Charaka says that you don't need to have a name for a disease. You're still going to assess by the doshas. You're still going to assess by Agni. That's why we have a Dashavida Pariksha and we have an Ashtavida Pariksha. Because regardless of what the condition is, we're still going to be able to assess these factors. And that's going to tell us exactly what is happening. Okay? Is there a question? Okay, so next. So this is just again, I wanted to show you to make it even a little bit easier as to how easy we can understand what this is. So if you go by the symptoms, and I know that I told you, one of the doctors made a very clear statement that you cannot diagnose a disease by the symptoms. It's very dangerous. But if you go by the symptoms, that in itself kind of paints the picture for you. So the ones here in blue are those which are typical Vata symptoms. Okay, so for instance, even in acute, you can have the reddish rash, the facial nerve weakness, and Bell's palsy. Again, it's a Vata issue. So whether it is an external causative factor for aggravation of Vata or an internal factor for aggravation of Vata, ultimately, this presentation itself indicates that it's some problem with Vata, right? Flu-like symptoms, fainting, shortness of breath, palpitations, chest pain. This also can very much be like Vata, but I will explain that to you in a second. Severe headaches, neck stiffness, again, Vata. Shooting pain that may interfere with sleep, again, Vata. Lightheadedness, again, another Vata symptom. And pain and swelling in the large joints, we talked about this a lot. So this tends to be more of a Vata and Ama-like symptoms. And if you look at the delayed effects or the symptoms of delayed onset of Lyme disease or chronic Lyme disease, these are all Sama Vata symptoms. Okay? So fatigue, headaches, psychiatric disorders like depression and mood changes, you find that in Sama Vata. Okay? It may not necessarily be defined exactly as that in the definition of Samavata, but when you look at if you look at the symptoms of Ama and you look at the symptoms of Samavata and you start to see the disorders that present with the same origin of disease of being Ama and Vata in conglomeration with each other, you find these same symptoms. So just like you were saying, Bharti, that if we are grouping all of these sort of conditions under one, yes, we are. We are kind of grouping this condition under one. And the reason why is because we see that if you were to apply the same treatments or the sort of trial and error that we have in Ayurveda to help in differential diagnosis, if you put in things that increase Ama, it makes it worse. If you put in things that help to reduce Ama, it makes it better, which is the same thing like I told you. That other patient in that case study, in that article, the girl took ginger and turmeric. And what did that do? It helped to reduce Ama. So it made her feel better. It also, she reduced the gluten. Gluten is guru. It is heavy to digest. So that's why if you're taking foods that are lighter to digest or easier to digest, automatically it is going to help to get rid of Ama. Because it'll help to reduce, at least, if not anything, it will not produce any more Ama. Okay, and that's what actually will help in this condition. That's the reason why she's feeling better by just those two factors. Okay, and what she also mentioned is that she still has some of the joint pain and some of the other symptoms, but considering that, she's still feeling much better with just these two factors alone. And that indicates, again, she's getting to the stage where the ama is gone, or the ama is being digested, but the vata is still there. Okay, so all of these signs and symptoms, these are all symptoms of samavata. So just a quick review of what are the signs and symptoms of sama doshas. And this is, again, this is in your notes from the first module, I believe. From the first module, we had talked about this. So samavata, we have constipation, adati, vague discomfort, lassitude, pricking sensation, a gnawing sensation, and aggravated by sneha, by any types of fat. Hence, hint, hint, application of oil, not a good idea. Okay? If ama is there, any kind of application of oil is not going to be good because it makes the condition worse. Okay? The symptoms also tend to become worse or more intense during the morning time, during the cloudy atmosphere, and at night. And that's like by definition a person who has Lyme, because they always say this. They may not say directly that they feel worse in the cloudy atmosphere, but if you ask them, they will say yes. Because I have not met anyone who has this condition who does not say yes to that question. And it almost always is the case. They're like, I don't know, today's not one of my good days. You know, one of the factors of Lyme is the fact that it's very intermittent, and sometimes the symptoms, sometimes they have good days, sometimes they have bad days. And what is that intermittent nature? That again is vata. The fact that if you were to really question and ask why they're responding a positive way or a negative way on different days, figure out what the gunas are. What are the components that is present in that situation? And even that will tell you why the person is feeling better on that day, or why the person is feeling worse on that day. Because even those things, we do know that pattern. So just look for the components. Look at all of the components. And if we put aside looking at just the bacteria and start to look at all of the components involved, it paints a very clear picture. It's actually really easy. But when you're focusing in only on looking at the bacteria and trying to do the treatment only for the bacteria, that's the reason why it's not successful, is because that's not the only component involved. Okay? So the sama pitta symptoms. So here, and the reason why I put up all of these is because sometimes you get people who have sama vata symptoms and sama vata and pitta symptoms. So it's good to not just categorize it as only sama vata. It's better to look at it as what is presenting in that person, because sometimes it may be multidimensional. So vata prakriti having slightly lower immunity, so prone to becoming symptomatic. Yes, absolutely. And that is true, because you do tend to find this sort of common factor as well. Many people who have the chronic cases of Lyme are either, or they have a higher intensity of symptoms in Lyme disease compared to some of the others, is that either they are vata prakriti, or they have entered into the vata stage of life, or they have such a high aggravating vata diet and lifestyle that it becomes an aggravating factor to make their symptoms a whole lot worse. Okay? So prakriti already makes them prone to getting to reacting more severely to this disease. But also, if they are in a vata vikriti state, then that also makes them more prone. Okay? So that's why I put in like the people who have these high stress jobs or high stress situations, they also tend to have that immediate severe reaction to the disease. Okay? So sama pitta, daha, burning sensation, Kantadaha, burning sensation in the throat, the Durgandha, foul smell, Shyava Varna, which is a blackish bluish discoloration, Amlika, acid belching, and Hriddaha, heartburn. Okay, and the last here is Sama Kapha, so Pichila, Tantuman, which is sticky and it produces a thread-like pressed between the fingers. It sticks to the palate. That's indicating if there's any sort of phlegm or exudate that's coming out. But it's also to look at the fact that these are other signs and symptoms that may occur. Okay. And lastly, I wanted to make sure that you know this. Okay, because this is a nice important part of it as well. In Vataja Jwara, that is described in Charaka Samhita, here also look to see if you see any familiar symptoms. Irregularity in the onset of symptoms and alleviation of symptoms. Irregularity in fever and temperature. Irregularity in acuteness and mildness of fever and symptoms. Excessive roughness, reddish color of nails, eyes, face, urine, stools, and skin. Excessive retention of urine and stools. Appearance of different types of consistent and migrating pain in various organs of the body. For example, numbness of the feet and cramping of the calf muscles. Feeling of instability in the knees and other joints of the body. Breaking, bursting, grinding, churning, cracking, bursting, twisting pain of the waist, flanks, which is like sort of like your sides, back, shoulders, arms, scapular region, and chest, and stiffness of jaw and noise in the ears. Pain in the temples, astringent taste in the mouth, dryness of mouth, palate, and throat, thirst, impairment of heart function, dry vomiting or dry cough, suppression of sneezing and belching, aversion to taste of food and indigestion, depression, yawning, flexion of the body, trembling, exhaustion, dizziness, delirium, sleeplessness, horripilations, and grinding teeth, and craving for hot things and comforts. Okay? So again, Vataja Jwara. Remember what I was telling you about Jwara is that it is something that cannot exist without Ama. It starts with Ama. So in that, now I know we didn't get through the whole topic because it is a big topic, and that's okay. There's still lots to talk about. But I hope this has planted a seed for you to think about as to what we would understand from what this Lyme disease is. And that from the perspective, even though our acharyas have given some very general signs and symptoms, again, if we start to plug it in where we are seeing it occurring in a person and start to move backwards from there, you will find the same sort of pathogenesis. So that even in a case of Vataja Jwara, where you have these particular signs and symptoms, somebody's presenting with the same signs and symptoms, even if they may not necessarily have the fever right now, but initially they may have had the fever or they may not have had the fever. But they also have these same sort of symptoms and they are responding in the same way or a similar manner as to what is expected for a person who has Ama and who has Vataja type of Jwara. Okay? So we are at 9:30. So I don't want to keep you guys up too late, but we can continue next week with more on Lyme disease, and I can even share a case study with you of one of the cases of Lyme disease that I'm working with right now. Okay. Okay, well, thank you so much, everyone. Thank you for joining. It was such a pleasure.
That was awesome.
Thank you. And there's still so much more, but yeah, read that article. It was really good. I loved it. And that was another one that had me laughing quite a bit. Yes, and Charaka is awesome. You know, as whenever you have free time, just read it, just at your leisure. because there is so much you're going to gain from Charaka. Okay. So good night, everyone.
Good night. Sweet dreams.